Well, hello and welcome to the Compass Health Activation webinar series. This is Eric Bricker, and I'm the Chief Medical Officer and co-founder of Compass Professional Health Services. And today's webinar is going to be on the secrets of open enrollment success, which we thought was very appropriate given the time of year and how many of you as employee benefits professionals will be beginning your open enrollments for your employee populations in the near future. And so we thought that we would share some best practices that Compass has encountered over the years with our clients, and best practices that our clients have also shared with us as well. And so to start that off, just a quick background about myself. We have many of our existing employer clients, existing broker benefit consultants that we work with, and then many prospective clients that are on the line today. So many of you are familiar with my background, but for those of you that are new, let me go over it briefly. So there's a picture of yours truly, and I'm a general internist, and I did my residency training at Johns Hopkins in Baltimore. And actually, before I went into medicine, I used to be a hospital finance consultant. So I used to be back in the billing and business office of major medical centers dealing with all the same claims issues that you as employers and benefit consultants and brokers deal with. But I was on the flip opposite side. I was on the doctor and hospital side of the claims because, believe it or not, doctors and hospitals have a hard time getting paid. So they hire outside consultants to come in and show them how to do that. So I had a ton of experience on the claim side and wanted to be more clinically oriented, so went on to medical school and residency, but really just saw a ton of confusion and frustration on the part of my patients, and really myself and my co-founders wanted to take what we knew as doctor and hospital insiders and bring that directly to companies and their employees, and that became just more and more relevant for folks as more employers moved to consumer-directed health plans or high-deductible health plans where employers wanted their employees to be better healthcare consumers, and the employees were saying, okay, well, I have no idea how to do that. And so we said, okay, well, we'll start this service, Compass, to provide tools and support for healthcare consumers. And so we're up to over 2,200 employer clients now, and it's just been a real honor and a privilege to be able to work with all of you and with all of our other clients as well. I also write a blog several times a week that has won several honorable mentions, and we also have a price transparency group on LinkedIn that has over 2,500 members. So you can either go to our website and subscribe to the blog, or on LinkedIn there's blog content as well. So what we do at Compass is we're tools and support for healthcare consumers. We call that a health activation platform because we want people to be more active participants in their health and their healthcare with their doctors and their medical providers. And that takes the form of, we actually provide the in-network price transparency for people, so we actually can let people know in advance what their out-of-pocket costs are by specific network, and then provide advocacy services around, okay, well, we'll schedule the appointment for you, resolve any problem medical bills for you. We'll even assist on the RX side as well. We just find a lot of doctors for people that meet the specific clinical needs of our members. And then we tie in a lot of people to their preventive services, which is great at identifying sort of silent disease like diabetes and high blood pressure before it becomes just a dramatic, life-changing problem for the individual and a huge claim for the plan. And then through Pathways of Care, we really steer people to high-quality, cost-effective providers within their existing network, and we call that the Health Activation Platform, which is delivered by our health pros and our technology to our members. Recently, we've added one of the nation's largest coal mining companies in our client of ours, an 18-state healthcare provider that has over 5,000 employees recently signed up, a publicly traded real estate data and analytics software firm has recently signed up with us as well, and really clients ranging from California to St. Louis to Florida. So we've really been super fortunate to have these new clients join us. Again, probably the commonality across all those groups is a desire on the part of HR and their broker benefit consultant to have their employees to be better healthcare consumers, and then using Compass as a tool to do that. And so on to our topic for today of open enrollment. And as we're going through, there's a way for you to type in questions during the talk, so please feel free to do so, and we'll answer them at the end. It turns out that only 14% of insured U.S. adults can answer 4 simple questions about what deductibles, copays, coinsurance, and out-of-pocket max are. Now, this is not because of lack of effort on all of your part and all of our parts as employee benefits professionals. We've had open enrollment guides. We have in-person open enrollment PowerPoint presentations, webinars, videos, online decision support tools, home mailings to educate spouses. So it obviously shows that this is a quote-unquote tough nut to crack if there has been all this effort and there still tends to be, frankly, just a very low level of employee benefits or health insurance literacy, if you will, in the general population. And we actually asked some of our clients to give us some specific feedback to use in this webinar today. And here's what they said about some specific open enrollment pain points that they have. So effective communications that are timely, relevant. Also, I would say engaging spouses into a joint conversation with the employee. That's a challenge for this VP of HR of a major utility company that has about 4,500 employees. And then for this director of benefits of a publicly traded energy company, she said, look, with 7 states, it's getting face-to-face, which we know doesn't always something we get to do. And then probably the second challenge is the system setup and the file transmissions, et cetera. So these may sort of ring true around effective communication, face-to-face interactions, file setup in terms of maybe some challenges that you share in common as well. And so we put today's webinar sort of in the framework of the 6 M's of open enrollment. In medical school, we always had to memorize all this stuff, and it was helpful to have these like mnemonics or ways to memorize it. So these are the 6 M's of open enrollment that, at least in our opinion at Compass, are some suggestions around best practice. This actually came out of a blog that I wrote, probably 4 or 5 years ago, and it literally had thousands and thousands of views. It was actually one of the most highly viewed blogs that we ever had at Compass, and I was shocked. And it came out of the fact that I personally, as a physician, have actually presented at like over probably at least 200 open enrollment meetings. Like literally, I would get up in front of a group of 50 or 100 or even 200 people, and I would explain what Compass is, and I would see all the other vendors present, and I would listen to their questions. And so literally being on the front lines and talking to employees and just thinking to myself, okay, as a physician and how I treat people at the bedside, and then looking at a company's claims, it became very apparent how we need to begin with the end in mind. We need to begin with how we educate people during open enrollment about their benefits in health care, and how that then translates into people's experience in the exam room and then the ultimate claims experience of the plan. And so I just thought, what a wonderful opportunity for a physician to be involved in open enrollment. I mean, there's probably very few physicians in America that have actually done that. And so I just wanted to take that sort of synthesis of that experience with kind of my clinical experience to bring these 6 M's of open enrollment to you. So the first M is to make open enrollment mandatory, right? So there's the whole choice for every employer of, do we want to have an active or a passive enrollment? And so an active enrollment gives an employer the opportunity to communicate and educate. It requires the employees to actually choose their benefits in order to be on the plan. So there's that automatic sort of motivation, if you will, to actually involve themselves in open enrollment, because if they don't, they're not on the plan. And then to them, depending upon the size of the employer, to use whether it's video or a company internet or intranet, in-person meetings or hard copy materials, or really maybe even some combination of all 4 to then educate the employees during the open enrollment process. Now, for some companies that have high turnover, whether it be hospitality or some nursing home companies or maybe agriculture, they might have north of 60 to 70% turnover in a year. And there, you need to be able to educate about benefits as part of the new employee orientation process, right? Because you might have an employee that completely misses open enrollment. They get hired in February, and then they start having claims in May before open enrollment has ever happened. So for those companies, especially that have high turnover, but even for those that don't, it's very important to make benefits orientation a key part of new employee orientation. And we've seen, as a best practice too, we've even seen some of our employer clients incorporate health and healthcare and employee benefits as part of their corporate values. So we have a $2.6 billion trucking and logistics company in probably in excess of 30 states with 4,000 employees. They're a Compass customer, and one of their corporate values is literally wellness. We embrace total health, and that value really permeates down through the entire corporate culture. So there's tactical things like, okay, active versus passive enrollment, but then really sort of from a strategic level involving benefits and a healthy workforce, and really being good stewards of the plan as part of a corporate value that we've also seen as a best practice. Of course, passive enrollment is the least disruptive. It's just easier, right? So the people are automatically enrolled in benefits as of the previous year. But we've seen both in Compass's experience and in a lot of experience of our clients that if you do a passive enrollment, that if you're lucky, you get 50% of the employees to engage at any level. So just as a benchmark, just know that if you are going to do a passive enrollment, that you're easily going to miss at least half the folks in terms of any sort of educational opportunity at all. And then this is feedback directly from Tiffany Cooper, who actually was on our webinar last month, and she's the head of benefits for the Nebraska Furniture Mart, where she said open enrollment meetings are mandatory for all employees and held in November. This is at Nebraska Furniture Mart, which has several thousand employees, literally has the largest furniture store in all of North America. We used to conduct all of these meetings in person, which meant having 25 in-person meetings in Omaha, where they're headquartered, not to mention the other sites like Kansas City and the Dallas, Texas area. However, we've added an online option in the past couple of years so employees can watch a narrated PowerPoint of the open enrollment presentation. And they take attendance at those meetings, and they take attendance on those PowerPoint presentations so they know who's done it and who has not done it as part of their mandatory requirement. So M number 2, make communicating with spouses a priority. So many of you probably know this across your benefit plans, where dependents often account for upwards of 30 to 60% of claim spend. And the types of spends typically fall into the categories of musculoskeletal, diabetes, cardiac disease, mental health, OBGYN, and it's obviously a combination of both medical and RX spend. So we can't just communicate with the employees, we have to communicate with the spouses as well. Okay, so now commuting with the spouses is a major blind spot, especially if you're making plan design changes, moving to a CDHP, whether it's as a dual or a triple option, or especially if it's 100% total replacement plan. And then some employers will even include spouses, premium differential, incentives, or penalties, or having HSA or HRA dollars contingent upon doing certain activities, and the spouses need to do those activities as well. And so obviously you have to communicate those as well. And so, well, I'm sorry if my audio is still not working out well. Let me see if I can troubleshoot that as we go along. But certainly keep letting me know along the way. So here's a couple of solutions. One is you want to be able to communicate, plan your specific changes, but then 2, you actually want to generate a mechanism for ongoing communication throughout the year and not everything at open enrollment. So in other words, it's not just, hey, we're going to communicate with spouses during open enrollment, but to create some sort of year-long way to connect with spouses over time. So video for smartphones, whether it be YouTube or Vimeo, that are either actually collecting spousal emails and then emailing out to them, or doing it through an app, or doing it through a member portal. At Compass, we have a member portal that we communicate out through video to spouses. And a lot of spouses we find actually really want this information because they're making the primary healthcare decisions at home. And so, and we have an app coming out for 2017 as well. So there is there needs to be a way to not only communicate during open enrollment, but also throughout the year as well. And then we even hear this from the Director of Benefits from this energy company, is we invite spouses to all of our meetings, mailing postcards as a reminder to the homes. Any online any online tool accessible from a computer is also a great help. So again, using the traditional postcards plus some sort of online way is certainly helpful. Know that if you do a postcard, really the best response rates that we've had from postcards at Compass are really 10 to 20%. Your typical mailing, if it's like junk mail, is like less than 1%. So to get 10% is like 10 times, but it's still only a significant minority. So it's important to understand that if you're going to do postcards, that can't be the quote-unquote sole approach to engaging sort of repeated technology-based route of communication is also super important. Message number 3, message of stewardship. How employees and dependents use their benefits impacts the health of the company and their future job prospects and their fellow employees. I kind of would tell people the story of the goose that laid the golden egg. And so that story, if you remember from Aesop's Fables, there was a gentleman who had a goose, and he took excellent care of the goose, and the goose started laying 1 golden egg a day. And this was wonderful. And the farmer would sell each golden egg every day, and he'd buy a new house and a new tractor, and he was able to have a wonderful life. But then he eventually, over time, he got greedy, and he said to himself, well, if I cut open the goose, then I can get all the golden eggs at once. So sure enough, he cut open the goose, and to his surprise, instead of finding all of the golden eggs, he found no golden eggs and had, in the process, killed the goose and destroyed any opportunity to have future golden eggs. So, of course, in that story, the golden eggs are the benefits that employees get from their health insurance coverage, and the goose is the plan itself. And so the employees and their spouses and all of their family members are sort of, we're all in this together to take care of the goose, so that the goose can continue to provide benefits and insurance and coverage for the entire employee population and their families. And so the challenge here is then with this Gallup poll result that says that only 32%, this is from several years ago, only 32% of employees are engaged in general. And this is not just about benefits, this is just about in their job, period. That means they're involved, they're enthusiastic, they're committed. 51% of employees are not engaged. In other words, they're just kind of checked out, they're sleepwalking, they just show up. And believe it or not, 17% of employees are actively disengaged, which means that they actually are intentionally trying to be destructive or disruptive at their place of work. Now, I will tell you that this probably varies widely across employers. There's some companies where the percent of engaged employees is much higher, and the percent of disengaged lower, and vice versa. But this, as you can imagine, and it's totally dependent upon company culture. So in a high culture company, this message of stewardship totally works. And at this energy company and at this utility company that I've mentioned here, where their folks in employee benefits have given us their feedback, they're incredibly high culture companies, and they have, as a result, fantastic stewardship on the part of their benefits by their employees. They get it. But not all companies are like that. I mean, it is what it is. It's important to face reality. And so in that situation, it's important that direct incentives and disincentives for the employees and their families need to be communicated. I mean, I've talked to a CEO of a trucking company who said, look, my employees are just going to think about themselves and what's in it for them. So be it. Then the incentives need to be structured that way. So if there's a premium differential or dollars into their HSA or their HRA contribution, it needs to be, hey, this is how this impacts you, Joe employee, specifically. And typically that penalty or that incentive that we've seen at Compass has the best result when it's in excess of the equivalent of $500 per employee per year. Okay. Now, it's also a great opportunity to teach employees about how healthcare spending impacts the company. Again, this is from that energy company where she says, be transparent and show the dollars. I'm finding employees have no concept of what the company pays for RX and medical on a monthly basis and what it means to be self-funded. I try to tie the dollar amounts to company performance and bonus. Again, that goose and golden egg concept, and even then translating that into part of how the spouses are communicated to as well, so that it is the spouse, well, this is just quote-unquote insurance that's paying for it. It's not insurance that's paying for it. It's actually their spouse's company that's paying for it, and that overall cost will impact potentially an end-of-year bonus or the prospects for a promotion or just the overall finances of the company, which again, for a high culture company, that message totally resonates. M number 4, medical is the main thing. This is one of my favorite quotes from Stephen Covey. The main thing is to keep the main thing the main thing. And medical and RX spending are the main thing. The latest, Kaiser survey results and these other survey results from major benefit consulting firms show that on average it's about 10 grand PEPY. Individual coverage is like 6 to 8. Family coverage can be upwards of $20,000 a year. And so with your blend of individuals and families, that's kind of how you get that $10,000 PEPY. Now, we see a lot of variation around that. We see some companies that encompass clients that are like 6 to 8, literally total blended for their PEPY. We see other Compass clients that are closer to like literally 16 to 18,000 PEPY totally blended. But that's the main thing. That's where all the people's health is super important, and certainly financially for the company and for the employee benefits important. That's the main thing. But there are all these other benefits, right? Dental, vision, short-term disability, long-term disability, group life, EAP, etc. I literally was at one 45-minute employee benefits presentation where they spent 15 out of the 45 minutes talking about their group life policy. It's unbelievable. I'm like, of all the things to talk about, a third of the meeting was dedicated to group life. So that was not the most effective use of time. And so literally what that translates into is, if you're doing an in-person meeting or webinar open enrollment meetings, try to keep it to 45 minutes. So that's M number 5, is keep it to 45 minutes. So it's a 1-hour slot, but oftentimes, open enrollment is not necessarily a priority. People are fighting fires on a daily basis, of course, so you want to allow 5 minutes for stragglers to come in. Then you need to allow time for questions. It's actually a best practice of adult education and adult learning that people have to interact to learn as an adult. So you either want to allow for 10 minutes for questions at the end, or allow for questions throughout that essentially extend the time by 10 minutes. And then applying the 80-20 rule to that 45 minutes, where you want to spend 80% of your time on medical and RX and 20% of your time on everything else, that translates into 36 minutes on medical and RX and 9 minutes on everything else. So you can't have it be a 160 slide deck, right? So it needs to fit into 45 minutes, and it needs to be stratified by this breakdown. And that really sets the tone and facilitates learning. Here's some more feedback from our clients. Know your audience. Wow them on the first slide. Be engaging and transparent. Connect with your audience, and tell them from the start of the meeting what it is they really need to know. Then they tend to pay attention to the rest of them. And then also communicate in real language, not insurance jargon. Be simple and give real-life examples to show how benefits work. I've seen a real good example of this in terms of not saying embedded deductible. When talking about individual versus family deductibles, that gets super confusing. So to use real-life examples of how an embedded deductible works instead of just saying you have an embedded deductible, I've seen be super helpful in having people get that concept during an open enrollment meeting. And finally, the 6th M is mentor on consumerism. So this is literally language that we've recommended to some of the broker and benefit consultants and employers that we work with to put in their open enrollment guide. So literally put it in there. Even if you stay in network, the price of healthcare services varies drastically depending on where you go. Another piece of verbiage that we recommend is, even in network, the price of an MRI, CT scan, endoscopy, knee scope, or blood test can vary by several $100s depending on where you go. That means at hospital A, an MRI can cost $2,000, and at hospital B, that same MRI can cost $600. And this is true for any network that you use, and this is true for almost any employer that we work with. The only exception to that being if you have a staff model HMO where you're kind of going to that HMO specific provider. So that's not the case, but the vast majority of our clients do not have HMOs. So as long as you have a PPO or a CDHP or even an EPO plan or POS plan, then this type of dynamic is going to exist. Additional, open enrollment is a great opportunity to educate around primary care. So this is, again, specific language that we actually have people put in open enrollment guides if they want. If you do not have a primary care physician, seeing one is a good way to receive your preventive screenings. Also, once you establish care with a PCP, they can see you for many reasons, from minor illnesses to sprains and strains to chronic conditions like high blood pressure. So really, that way that healthcare should be accessed is through a primary care physician first. And certainly, if you need to see a specialist, by all means, please go. But oftentimes, not only can the primary care physician potentially take care of that issue, but then two, they can act as that quarterback or coordinator amongst all the different specialists. I mean, the number of times I've seen conflicting medicines and conflicting tests among specialists, I mean, I could write a whole book about it. But if you have a primary care physician sort of acting as the clinical medical home for the employees, it's a much safer way and more effective way to access the healthcare system. And then here's some more advice from Tiffany Cooper at Nebraska Furniture Mart. The average time spent with a physician is 7 minutes. So I always tell people, if you're getting $225 worth of care in 7 minutes, please go on seeing that doctor. If you don't feel like you're getting your money's worth, why not shop around and see if you can get a cheaper alternative? During open enrollment, the Compass Health Pro can walk employees through their personal situation and help them decide which plan option might be best for them. So not only is it a group educational opportunity, but for folks that use Compass, we actually sort of educate people one-on-one so that they can ask us questions during open enrollment. We have one group of 1,000 ministers at kind of small churches across the country. And these folks, I mean, God bless them, they know all about God, but they don't necessarily know a bunch about employee benefits. And so to be able to, and they move to a CDHP, and to be able to explain to them at HSA on kind of the individual level was super helpful for them. So just know that that is strategically how some employers have used Compass as well. So how do you know if your meetings were a success? And then, of course, this is a very terse and fun answer. When our phones don't ring on January 1st. In other words, that's a very articulate way of saying when we have anticipated our employees' needs and they feel as though all of their questions have been answered in advance. And then also, a successful open enrollment is one in which employees actually think about their coverage. Employers spend a lot of money on this. It's part of their total compensation. And it really is, it's not only is a better way for them to use their benefits, but frankly, they just appreciate their benefits better when they're educated about this. It's difficult to measure, but sometimes can be seen in the results. So here's a summary of the 6 M's of open enrollment. 1, mandatory. 2, make communicating with spouses a priority. 3, message of stewardship. 4, medical is the main thing. 5, minutes equals 45. And 6, mentor on consumerism. And so with that, that brings us to the conclusion of today's webinar. And so I appreciate all of you. You've actually all stayed on throughout our technical challenges throughout. So I really appreciate all of you continuing to attend. If you would like to continue to educate yourself around the employee benefits space, our blog is a great way to do that. We literally have thousands of people a week read the blog. It's about employee health, health plan management, price transparency, how to engage employees in their own health, how to help employees navigate the healthcare system, various healthcare trends. So I'd encourage you to do that. Of course, if you would like a copy of these slides, I'd be happy to send them to you. If you just email me at ericb@compassphs.com, I'd be happy to email them back to you. Also, if you would like to follow me on Twitter, I'm at drericb.com. We always record and then repost these webinars. So if you missed, I'll tell you, the one from last month from the Nebraska Furniture Mart was super popular. So if you'd like to listen to that webinar or any of the other webinars from previous months, you can go to our website, compassphs.com, and then go to the Best Practices tab and then the Webinars sub-tab, and then you can see all of the previously recorded webinars as well. And so let me see if you have any questions here before we wrap up. And if you are thinking of any questions right now and you want to ask them, then please feel free to as well. I'm looking through all the comments, And you all very gracefully were helping me out in terms of the audio earlier in the presentation. Okay. Well, with that, I'm sure everybody, as we approach open enrollment, has much to do. So with that, I will thank you, as I typically do, for the most important thing that you have given me today, which is your time and your attention. And so with that, I wish you a great rest of your Tuesday and a super successful open enrollment. Thanks so much. Bye now.